HCA interview questions and answers for Ireland. Infection control, hand hygiene, hand rub 20 to 30 seconds, hand wash 50 to 60 seconds, 5 moments of hand hygiene, before touching patient, after touching patient, before doing any procedure, after exposed with blood and body fluids, after touching patient environment, hand hygiene steps. Palm to palm, left palm over right dorsum with the finger interlaced and vice versa, palm to palm with finger interlaced, back of the fingers to opposing palms with finger interlocked, rotational rubbing of thumb finger in right palm and vice versa, rotational rubbing of fingertips to opposite palm. PPE, dunning. Dunning means wearing. So we should do hand hygiene first, then gown, mask, goggles or facial, then gloves. Doffing. Doffing is removing. So we should remove the gloves first and hand hygiene, then goggles or facial, then gown, then hand hygiene. Then we should remove the mask outside the room or ante-room, then perform hand hygiene. Then laundry management. Staff should use PPE while handling laundry, and used linen should not be placed in a clean area or on the floor. Remove bed with care, avoiding the creation of dust. Do not share, do not shake, do not manually sluice or hand wash items soiled with the blood and body fluids. Infected linen is collected in alginate bag. Do not fill the alginate bag more than 2 by 3 full. Close or tie the bag. Then management of sharp. Do not rake up the needle. Syringe and needle should dispose in a single unit. Should not pass the sharp from one person to person. Sharp bin always kept closed. Never fill more than 3 by 4. And the next one is how will I know that the room is infection but I did not talk with the nurse and I wasn't on report? There will be a signage board. So there's a 3 signage board: contact, droplet and airborne. The contact is green color and we should wear the gown and gloves for that, and if need we can wear the mask as well, surgical mask. And the droplet is red color in the board. The droplet is red color board. So here it's important is the surgical mask. So if we need, like, we can use the gown and gloves. Then the airborne, it's here, it's a blue color. So we need to wear the FFP2 mask or N95 mask, and all other PPE with the gown, gloves and the face shield. So, and next the waste management. So we have 3 bins, like white bin, yellow bin and sharp bin. So white bin is non-infectious waste, yellow bin is infectious waste, and the sharp bin is all sharp items. So how will you prevent spreading of infection? We should do hand hygiene, PPE and respiratory hygiene or cough etiquette, routine environment cleaning, linen and waste management, educate the patient to use alcohol-based hand rub whenever needed, discard use PPE inside the patient room provided. So the next one is the intake, like intake and output. So if the healthcare assistant is giving food to the patient or giving any fluid drinks to the patient, and if they are emptying any urine bag or cleaning the bowel, so we should inform the nurse that how much amount of urine they have emptied, and the bowel, the color and amount of the stool. And the next is if they are drinking, the amount of water they took and the food they took. So it's important to inform the nurse, so they will document and they will maintain the intake and output chart. It's needed for the nurse for the documentation purpose. Okay. Then the health and safety. The key point of act include provide safe place of work, includes fire safety, cleanliness, waste management, provide safe equipment. All the equipments at work needs to be maintained to ensure safety, ensure all staffs are properly trained, provide proper facilities. All the measures need to be considered for the health and safety of patients and staffs. So HIQA. HIQA, its the expansion is Health Information Quality Authority. It is an independent authority established to give high quality and safe care for people using our health and social care services in Ireland. So the HIQA has 8 standards. The first one is person-centered care and support. Second one is effective services. Third one is safe services, health and well-being, leadership, use of resources, response workforce, and use of information. And how we will handling the angry patient. So if the patient is angry, we should not take this as personal and think that angry is not about me. So then assess your safety. Like if need, we can call the security, and if possible, after it, acknowledge the anger. Like we can say, I feel like you are angry, and ask the patient concern or the reason for the anger, and stay silent and listen what they are saying. Do not interrupt them, and try to console them and show them that we are attending their issue. After an alternative outlet, like if they're still not resolved, we'll inform to the nurse or supervisor or the line manager. And finally, complaint policy and the incident report we have to make and inform our team. So the next is fall prevention, how we can prevent the falls. So we have to keep the bed in low position, avoid slippery floor and wet floor, keep side raise up, keep fall risk sign on the floor, and keep personal alarm or post alarm. So then what you will do if a patient falls or find a patient on the floor? We should call for the help, and we should do the head to toe assessment of the patient, inform to the staff nurse immediately and report them if you see any obvious findings, and shift them to the chair or bed if no contraindications, and used hoist if needed. And incident report, we have to write the incident report. Next, how you will develop your knowledge. Continuous education, bedside teaching, monthly meeting regarding new updates, and periodic appraisal. And we can learn from our seniors, and the HSC like training courses we can attend. It's included in the continuous education. Next is handling a difficult coworker. So if it is mild, we can ignore, stay cool, try to talk with them directly, don't argue, don't shout, have a good support, address the issue. If resolved, leave it. If not, inform with the supervisor. And how we can handle the angry attendant or angry family or difficult patient family. So what we have to do is we have to remain calm and listen carefully. So do not interrupt them and address the issue, and be empathetic. Simply apologize, and if still angry, allow them to complain. We have complain, explain the complaint procedure, and we have to inform the line manager. And how you organize your work. Make a list of jobs to be done, prioritize the task, manage your time well, delegate tasks, and stay organized to all the shift. And how will you prevent teamwork? The teamwork is to maximize the patient care, improve patient satisfaction and outcome, higher staff satisfaction, professional accountability, improve engagement in workplace, collaborate with others to provide appropriate care like other co-workers. That's it. So if you're doing this, the teamwork will improve. Have you adopted changing? No need to panic. Try to attend class, clarify with coworkers or supervisors, keep myself updated. How will deal with pressure at work? I would like to work under pressure to take it as a challenge. Should not be panic, plan, organize, get help from others. What did you prepare for interview, work experience and HSL and training courses? What should do if had bullying? Ensure safety of client and staff, inform designated officer or line manager. So the safeguarding. Safeguarding, it's very important to support, to find out, respond and report about safeguarding concerns regarding adults at risk of abuse. So listen their concerns, inform to line manager. Next is pressure sore. So how we can prevent the pressure sore? There is a skin bundle. So the yes is Sapphires. That's the mattress, that like care mattress or dolphin mattress. And the next is the skin inspection. We have to check the patient's skin frequently. And the K is keep patient moving. So positioning is very important. If the patient had pressure sore secondarily, we have to position the patient. And the I is incontinence, changing pad frequently. And again is nutrition. So we have to give high protein and increase water intake. So the next is routine care in nursing home. So handover, check the residents, meet hygienic needs, provide food to residents like nutritional needs, and mobilize to day room or activity room and communicate with them so we can just meet their communication needs as well. How will you maintain confidentiality? So we have the policy of GDPR. We need to follow that one. So should not share any information about residents to outsiders. Should not talk about any patient or residents while on break. So if the ward is short staff, how will we manage? We have to organize the task, prioritize the task, teamwork, and if we'll enter into one room, we should finish everything at a time.